So how would you explain to, you're in an elevator with someone and you have 38 seconds to explain what
cranial
craniosacral
is?
therapy is?
It is a light touch, soft tissue modality that manipulates the central nervous system.
And the number one challenge is putting aside your biases, you said?
Putting away my bias. So especially with a sports medicine background, and other craniosacral therapists may have a different outlook on it. It's almost, think of like a file cabinet, and you're running through this file cabinet of, say somebody comes in and they have low back pain. How many thousands of things could be causing low back pain? So how do you remove the bias of that file cabinet, get it completely out of the way, and then touch the person and be like, oh, well, their tongue is restricted on the left side, back by their back two molars, and they've got their hyoid pulled to the left, and it is pulling their atlas out of position, and now they have a fascial pull down the front of their spine. How in the heck did I come to that conclusion? Just by touching them. So, in removing that bias of people that would chase the pain and go treat the back. Does that make sense?
Yeah, yeah.
So that's the hard part about trusting what you feel under your fingers and your hands versus pulling this file cabinet out and be like, well, there are 15 orthopedic things we could do for low back pain. Here's all the things we could do viscerally for back pain. This is what we could do from a lymphatic standpoint for back pain. This is, and then going to look at their history and be like, oh, well, maybe I am on the right track because they have a bridge in their mouth. They've had their jaw reconstructed. They have a history of concussion. They're a professional golfer, so they've got a lot of upper cervical issues. So sometimes I'll be honest, and every clinician in the world is going to think I'm a terrible person, but sometimes I don't even look at their medical history because I don't want to know. Even if I've treated them 4 or 5 times, I just don't want to know because I don't want that bias going into the session.
Yeah. And it must be difficult because when someone comes in, they immediately probably want to point.
Yeah, and I'm just like, stop talking.